to live life in the beauty of what is there and finding it. We have to continue to teach each other as to how we can overcome. What is it that I have to do to continue living a good life?
Welcome back to the Community of Innovation podcast, brought to you by the Center for Aging and Brain Health Innovation, otherwise known as CABI, which is headquartered at Baycrest Health Sciences in Toronto. I'm Allison Sekuler, Managing Director of CABI and Vice President Research at Baycrest.
And I'm Roseanne Alliong, Director of Research, Innovation, and Translation at Baycrest. Today, we're back with Episode 12, Part 3 of our COVID podcast miniseries in collaboration with Baycrest at Home.
And before we get started, we want to acknowledge that CABI sits on the traditional land of the Huron-Wendat, the Seneca, and most recently the Mississaugas of the Credit River. And today the land is home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. As we enter the fall, we've learned a lot about COVID-19 over the past few months, and particularly its disproportionate impact on Black, Indigenous, and people of color communities. And today we're going to be speaking with 3 Indigenous Canadians who are here to share their experience with COVID-19 and why culturally appropriate and safe innovations are so essential to supporting Indigenous communities during this difficult time. The podcast, as Roseanne mentioned, is being co-sponsored by CABI and Baycrest at Home. So I want to start by asking Simon Cheeseman, who's both Baycrest at Home's director and one of our podcast executive producers, to tell us a little bit more about Baycrest at Home. Simon.
Thanks, Allison. Baycrest at Home is a service for family caregivers of people living in the community who are experiencing cognitive decline, memory issues, or perhaps have a formal diagnosis of dementia, and they're beginning to experience struggles remaining in the place they call home. And it provides services and expertise that you would normally only find on a campus like Baycrest that brings a lot of geriatric specialists together in one place. And we use technology to put that in the hands of people living in the community and helping their loved ones to stay safe and comfortable while looking after their own well-being and making sure that they stay safe and capable of doing that job. And part of what we provide to family caregivers is information and resources that will help them continue to do that role effectively. And this podcast is part of that. It lets people know they're not alone out there. It brings the experience of others to them that they can take advantage of. And we're very excited to continue that with today's episode.
Thanks, Simon. As we kick off the pod, we want to welcome our guests. First, Dr. Carrie Bourassa. She is the Scientific Director of the Canadian Institutes for Health Research Institute of Indigenous Peoples Health and a Professor of Community Health and Epidemiology at the College of Medicine at the University of Saskatchewan. She's also an adjunct professor in the faculties of Education and Kinesiology and Health Studies at the University of Regina and heads the Canada Foundation for Innovation-funded Morning Star Lodge, which was established in 2010. And I had the opportunity to visit there last year, and it's amazing the work that they're doing. We'll hear a little bit more about that later. Across her various roles, she leads the advancement of a national health research agenda to improve and promote the health of First Nations, Inuit, and Métis peoples in Canada. And of particular relevance for today's pod, Carrie's recently been appointed as the Indigenous Engagement Lead for Canada's COVID-19 Immunity Task Force, and also as the Indigenous Lead for the Rapid Response Team of the Saskatchewan Health Authority. Carrie is Métis, and she belongs to the Riel Métis Council of Regina. Welcome, Carrie.
Thank you. Happy to be here.
Our second guest is Sadie Anderson, who is a Plains Cree woman registered to the Pukissis First Nation. She grew up all over the provinces of Saskatchewan and Manitoba and returned to Regina after living abroad in the United States. She has a Bachelor of Arts in Sociocultural Anthropology from the University of Regina First Nations University of Canada, and she's worked in both the public and private sectors before running her own successful business in the U.S. for several years, but then returned to Regina to be closer to family. Sadie currently is the lab manager for Morning Star Lodge, and when she's not working or taking care of family, she can be found knitting. So I am definitely going to catch up with her to get some latest patterns and advice. So welcome, Sadie.
Thank you.
I'm not going to be catching up on the knitting because I'm left-handed, so I never learned how to knit, but I'm really amazed by people who can do such terrific things with their wool. Finally, I want to introduce Ethel Starblanket-Dubois, who was born and raised at the Starblanket Cree Nation, into a family lineage of political leadership. After spending much of her childhood years in a residential school, Ethel went on to complete a certificate of Indian social work from the Saskatoon Indian Cultural College, where she had elder support and guidance, as well as a bachelor's degree in social work. And across her varied degree, Ethel has worked as a trainer in cultural sensitivity, a treaty women's coordinator, a truant officer and home visitor, researcher, and teaching assistant. And for more than 25 years, Ethel has been working as a mental health professional with Indigenous groups, including the Starblanket Cree Nation, the Piapot Cree Nation, Carrie the Kettle First Nation, Papikasis First Nation, just to name a few. Welcome, Ethel. Great to have you here.
Thank you.
So we wanted to start our discussion with somewhat of the personal experience of our guests with COVID. So Ethel, can we start our discussion today by asking you to share with us your personal experience of COVID as an Indigenous Canadian elder?
Yes. The first thing that happened to me was I was still working. We had to make a decision as to whether or not we wanted to leave our employment due to COVID. And I had to consider my health issues that were dormant. They're still dormant, and to try to understand how this COVID was going to impact me even more. So I had to seriously look at my own personal health and also the risks that were involved with clientele coming in and all of this. So a lot of changes, both in work and personal. I also had to worry about 3 grandchildren who live in the U.S. I wondered about them, hoping that they would be fine, tried to connect with them and make sure that everything was going good with them. And their parents had reassured me that they were doing the best possible things that they could. I had 1 grandchild at home, and my son was single parenting. With him, he was really into the isolation bit, removed his child from school. He was in grade 3 and managed to do stay-at-home projects in terms of his education and wellness. A lot of times, the recreation even had to be changed, like he was a ball player and things. So outdoor activities changed to more indoor. For me, I learned to come to some form of acceptance, still continue to contact clientele through the phone, be supportive as much as I could to them, as well as for my own self. I had to not only look after myself, but my partner had just gone through open heart surgery, so I had to make sure that things were going good for him as well. I'm very thankful that we both follow our cultural ways and that he is a healer. And so we discussed a lot of the healer capacity as to, okay, where are things, how do things stand with the rest of society and the rest of our people? How are we going to continue helping them in this way? And so our belief system became much more stronger, because in the springtime is when all of the big ceremonial lodges come up and all of this. And so we gathered ourselves together and we were able to support the other community members in coming together in prayer and getting them to understand that, hey, Creator sits with us in these ceremonies, and try not to have so much fear or concern. Just put yourself mentally and spiritually into your own awareness and have that strong faith that follows with our ways. So that worked. And even in my own participation with the fasting and dancing in the big lodges, it came out where, I sit here today in good health because of the protocols that I followed. The other thing that impacted me was my daughter is a frontline worker in the addictions field, and she lives in the neighboring reserve of Alberta, and she happened to become exposed to a client. So I had to become more supportive to her and help her to overcome. She felt so isolated, away from family members, and all of this was had a very strong impact on her. So there were times where I've had to walk her through a traumatic experience. In the end, it came out where she tested negative, and so I told her, just continue to do safety precautions, follow protocol, reach out for your supports, know who your supports are, and just was able to help her through that.
So Carrie, just building on Ethel's experiences, we're wondering what your view is of how Indigenous communities think about their physical health, and how that sort of intertwined with sort of cultural approaches. I'm thinking really about the intersection, because it really seems like Ethel paying attention to a cultural heritage and the traditions was so important to help her get through the period that we're going through, and also in supporting her daughter in getting through what she was doing. So what's your view about the relationship between culture and health in the Indigenous communities?
Well, I mean, I think that health, as I was taught by many elders, and my cookum, who's a pipe carrier, health. There's actually in Indigenous languages, there's no word for health. You can't translate it. It's if you translated it, it's more like being alive, well, that kind of a thing, right? It's about wellness. And so for me, health is about being grounded in your values, being grounded in the traditions that you might be passed on to, and for Indigenous people, our blood memory is there. Whether you reclaimed your identities, as a result of all of the trauma and colonization, residential schools, 60 scoops, or if it was passed down to you in the traditional way. But not everybody might. Not everybody might have that opportunity. There's also, there's an elder that I used to learn from, and on Sunday mornings he would do ceremony in his teepee, and then he would go to church. So I think health is culture, and culture is health. You can't sort of pull them apart. And to be healthy, you have to think about all of the domains, mental, emotional, physical, spiritual. And we usually forget about the spiritual, is what I think, and spiritual can mean many, many things, right? It could be putting tobacco out on the land. It could be, something more formal, going to church. It could be it could be anything. It's what feeds your soul, right?
Yeah. Sorry, now just one question I had is because as you're speaking, and from the little that I've experienced myself, so for example, going to a healing ceremony a few years ago, a lot of the culture and the traditions are communal in some ways. So some things would be done in isolation, but a lot of it is sort of bringing together the community and not done in isolation. So I guess I'm wondering the broad impact of COVID-19 and the need in some cases to have more isolation and more social distance. How has that impacted the approach to health in Indigenous communities?
I think it's had a huge impact, because you're right, we are very community-oriented people. And so not even, I think the grief factor right now is something that really couldn't be overstated enough. I think that, not only in terms of, we know that people have passed and we can't grieve in the appropriate manner, but grief just in terms that compacted grief, compounded grief, that, we can't come together, I know in our communities, even when things are the worst, coming together and not only consoling each other, but laughing, laughter is the best medicine. And in our communities, when things are really the toughest, that's when we come together and we eat, we share a meal together. We tell stories, those kinds of things. And not being able to come together is really vital. And I think a lot of people that I've spoken to, a lot of my friends and family and kin, it's about not being able to connect, and that grief, and a lot of tears shed, just, not being able to connect. Even just on FaceTime, sometimes just having a good belly laugh is important, but not everybody has access to that, and I think of people that, are in remote areas and they can't even do that. So, and then not being able to really engage in ceremony. Yeah. Ceremony is vital to our health and well-being. And we can't do ceremony. Well, some are starting to now, elders are starting to now do very small group ceremony, but it's not the same. And it's I think, very difficult for some people to make the decision if they're, highly immunocompromised, to even go to something like that.
Yeah. And I think people underestimate the importance of mental health well-being and how that is also impacting your physical health.
So, building on Carrie's eloquent description, Sadie, I want to ask you in terms of issues of access and resources and what that has looked like for your community and particularly elders in your community.
Well, what we're noticing is a lot more isolation. So we're trying to involve as many people as possible. I know that originally a lot of people went to the land to find their own peace of mind. You've seen a lot of people going out on the land, a lot of instruction to go out on the land in a safe way where you can do it. We've seen a lot of emotional struggle going on, and that's all of our health, right? Like, we need to regain that health. As we've expanded to be able to have pods and whatnot in the various allowances, that's been beneficial. You've also seen some First Nations that have closed their borders to keep their people safe. So they have less issue with pods or with larger groupings, and have had significantly less issues allowing people to intermingle. But it's all about what level people can do. And access is an issue. We're trying to, I know at Morningstar Lodge, we've just recently started something to try and get better food sources to seniors. And so we'll be delivering food boxes. And that's to try and mitigate the fact that seniors have a hard time when they're immunocompromised, and many seniors have multiple compromises, be it, elderly, asthma, COPD, diabetes, heart issues. Like, there's the whole host of them. So going out and getting groceries can be very taxing, aside from the fact that they could run into shortages. We're seeing lots of shortages in grocery stores and whatnot. So if we can mitigate that factor with our research in any way, and help them, that's really what we're looking to do right now, because that's going to, if we can provide them with some sort of healthy food for a duration of time, we're hoping that takes some of the stress off, because stress leads, of course, to depression and all those other things. And it's already compounded for them because they can't see their families and they can't see their grandchildren. And that's a source of life for a lot of people.
So you talked about communities closing to the external environment. Has there been other restrictions in terms of in the Indigenous communities that you guys have experienced?
Right in the beginning of COVID, in the heart of COVID here in Saskatchewan, several First Nations closed their borders to non-essential traffic. We did see in the north, in a case of several highways closing, that it ended up being not as good for the First Nations people, because they ended up getting ticketed to go down to get healthcare. So in the north, where they're further rural and remote, they could drive anywhere from 2 hours to go to see a doctor. So for those who are making drives down to the larger urban centers to get cancer treatments or dialysis or any other forms of treatments, they were actually hitting roadblocks and getting tickets. So that ended up not working out as well in the north. Originally, I believe that was to try and stop people from going up north to visit their cabins and such, because that was the cause of some of the outbreaks we've seen. And of course, we had the giant outbreak in La Loche that was massive. And so that also caused a lot of issues for people in travel, in ability to access things. They did great work out there fixing it and stabilizing it. But again, travel is a big issue. And as soon as the snow flies, I think we're going to have even more trouble up north, especially if we do get the second wave that's being predicted.
Yeah, it sounds like, I mean, obviously, whatever solutions we have, one size does not fit all. And I think that's particularly the case when it comes to considerations around Indigenous communities. I mean, often when we're thinking about health and Indigenous health, we have to think about cultural safety. And it seems almost like a set of rules are put in place, and it's assuming everyone lives by the same sort of rules and in the same way. And that's not necessarily appropriate in this case. And I'm wondering how you think cultural safety comes into play in response to COVID-19.
So we've actually, it's interesting. We've actually done a whole lot of work around cultural safety, and particularly in relation to COVID-19. And a lot of the presentations that we've developed, people have been quite appreciative of linking the two, because it really is important thinking about at this point in time how important cultural safety really is. Right now, COVID-19 has really sort of shown us, what we've already been experiencing as Indigenous people, but it's exasperated and magnified. And so, we know that, of course, social determinants of health are vitally important, but they're also different for Indigenous people. Right. And Indigenous people are experiencing, systemic racism and stigma and bias. And this has, again, just been exasperated through COVID-19. And of course, also access to appropriate healthcare is important, and that's connected to cultural safety. Are the services culturally safe? Are they accessible not only geographically, but in terms of what their needs are? And what the needs are for Indigenous people are very different. The griefs that they're experiencing, for example, is compounded because many of them have experienced residential schools. They were 60 scoopers. We still have an Indian Act in place, and I always try to point this out, that the Indian Act isn't something in the past; it's still impacting us. And so we're not only dealing with our trauma, intergenerational trauma, historic trauma. We're dealing with, the now trauma and the intersection of that. And I don't think that many of us have really thought about that and really thought about how are we going to address that. And it's not, about blame or shame or anything like that, but just the context of it. Because if you don't have a context for it and really understand the context, it sort of speaks to the TRC. That's the truth. And if you don't have the truth, you can't get to reconciliation. So it's sort of thinking about, cultural safety in my mind is looking at the structures, right? The actual structures, the barriers, in terms of really addressing those issues, and that has to come from everyone.
Yeah, Ethel, just following up on that, have you felt that the issues that you were dealing with before have just been amplified through COVID, as Carrie's suggesting?
Yes, I felt a little bit of that, especially when going out, the looks and stares of, the people, just actually seeing you out there trying to do your shopping or getting the basic things that you need in terms of survival. This COVID stuff has put, I think, all of us into survival mode again. And a lot of us have learned to not let it be as stressful as it should be. For myself, I've just had to look at it like, accept what's come, but at the same time, try and put my mind into thinking that, well, if it's going to get me, it's going to get me. If not, that's fine. And I'm grateful, that good things are happening where I'm well looked after, and have to, just live each day like that. But it's brought to my own personal awareness as to what do I need to do in terms of survival, and even planted a garden this year and managed to, get some vegetables on the way for, the winter and the fall. So, stuff like that is the survival mode is and your awareness to, how am I going to live, or what is it that I have to do to continue living a good life.
Yeah, it's such a good attitude. And I think, again, having that positive attitude, that the resilience that you've developed, obviously, through the years is coming into play. And it must feel sometimes like we often talk about one step forward, two steps back. And I almost feel like right now it's for many in the Indigenous communities, like one step forward, six steps back. But the more that you can do to regain that connection or extend that connection with the land and think about the future, is that sort of what you're doing to help get you through this?
Yes, and with family support, like my two older sisters have gone out on the land and picked medicines that are going to be helpful for this next round. And so, being able to find the resources for our traditional medicines is quite a big thing for our own community. And even for our own community, when our chief, our leader, went and delivered medicines for each household to use to combat the flu symptoms. And so we were well taken care of because we are a traditional community.
Yeah, it's interesting is that when I'm thinking back to my visit to the Morningstar Lodge and the health centers around there's some amazing places that are have a great mixture of Western and Indigenous health that Carrie was able to take me to visit. And I think that was where I really understood that. I think a lot of non-Indigenous folks don't realize the medicines. It's not like you pick it and then, here you go. It's just straight from the ground into someone's mouth or whatever. There's a lot of preparation that's needed, right, with all of the medicines that are gathered. And I wonder how much more of a challenge is it now when there is additional need coming up because there's going to be these spikes in disease and the resources may be harder to get. Is that posing a challenge, just keeping everything being that there's so much extra preparation, I guess is what I'm saying. And how is that being dealt with?
I believe that there's going to be some form of shortage somewhere, whether it's in our Western medicines or in our traditional medicines. Like a lot of our First Nations people are not as prepared as some. And so, we really have to be careful as to how much we could share of what we have available. But at the same time, our people have got to start looking inward and become aware that, hey, I have to put some belief into this that I'm going to be okay. And that's their 50% of making everything work right. It's always been that way. And I believe that, if we have to continue to teach each other as to how we can, overcome and get through a crisis situation, and I believe, and without not getting sick over it. That's one of the trauma that a lot of our people have taken on in the past, whereas we've become so sick out of all of the stressors that have come to us. And so, but learning how to balance everything in a holistic manner, I guess all of us can manage somehow and kind of look for hope and make sure that, we're okay. The most important thing is making sure that you're okay before trying to help others.
So I know, Sadie, you started a little bit earlier talking about the initiatives at Morningstar Lodge and kind of building on what Ethyl's talked about, how to support your Indigenous community. Did you want to share with us how innovation has played a role in supporting Indigenous elders and others during this time?
At Morningstar Lodge, we realized very early on, we were hearing from our community partners that they had a big need for culturally safe and relevant COVID-19 information. So we hit the ground running. We're a small team, we're a tight team, and we initially released the COVID-19, both the community and the clinician fact sheets, which basically went through some details. It was in a much more colloquial method of delivery. Our community fact sheet featured a lot of pictographs, so it wasn't as heavily on the words. Very simple ideas such as like wash your hands, things you could do at home, things to entertain you while you're stuck at home, because originally we were all stuck at home and we had to figure out a way to do that. So as a group, we actually brainstormed through a bunch of things. We ran it through several of our community counterparts, such as the All Nations Healing Network, Canadian Virtual Hospice, File Hills, Quappel Tribal Council, and they all approved of it. And subsequently, we ended up, once we had done that, people were saying, okay, that's great. Why isn't this in Cree? Why isn't this in Michif? Yeah. Where is my version in Saulteaux? So we got a grant and we went about finding translators, which is a lot of work. So we ended up doing, I believe, 7 languages total so far for those 2 fact sheets, which we have Nakota, Cree, Saulteaux, French, of course, was the first one that got done. It was the first requested one, but then we went through the languages as they were requested. It was also translated into Portuguese by subsequently it was done by a colleague of Carrie's at the university who wanted to utilize it for a different grouping of people because it was so easily interchangeable. And then after we released those, they're like, okay, we need more. We're like, okay, what more? And so we were instructed various fact sheets that they wanted. We also did a whole line of videos, how to wash your hands properly, how to socially distance when you're outside, keeping sane at home, how to make medicines, or how to do cedar tea, how to do muskeg tea. We have a former, he was a personal trainer on staff. So he graciously gave us an exercise video. So exercises you can do in your own area. He went outside and did them, but you can do them in your house, in your living room.
And it was funny too, because laughter is important. So yeah, it was good.
We don't take ourselves too seriously, that's for sure. And then, of course, after all that, people are like, still wanting more. So we created packets. We decided to name the strategy Protecting Our Home Fires, because the home fire is so important to Indigenous First Nations, Métis, Inuit people, right? The home fire, that's where everybody meets. That's where everything gets done. That's your family. That's what you protect at all costs. And so our first packet was kind of a hodgepodge for all ages. And then that one was picked up by one of our partnerships, Le Fille de Madeleine, and they ended up putting it in some of the hampers that they handed out. It was also picked up by All Nations Healing Network, and they distributed it with some lunches that they were giving out in inner city Regina. And so they turned around and said, okay, we need more. And we said, you got it. We ended up doing 2 more packets. And they're about 40 pages-ish. We have printed them for people. We also have the PDFs available on our website of them. There's one now for children and youth and one for adults and seniors. And they really play to things you can do while you're isolating or while you have to quarantine or what have you. We've got everything from crosswords, Sudokus, recipes. There's a charades game in Cree that one of our people did. And it speaks to, it's very specific. So all of our recipes are, of course, Indigenous recipes. They're recipes we've shared, like how to do elk balls and like all kinds of things. And then, of course, learn counting in Michif. We've got coloring pages that are culturally relevant. We've got beading templates for beading competition, possibly. And basically, we just tried to throw in everything but the kitchen sink. Our crosswords are traditional. I believe one of them is traditional foods. So you're searching for traditional foods. And those were lots of fun to make, and they've been really well received. And the next one coming out, I believe, is how to do ceremony socially distanced. We're just working on that right now. It should be out hopefully very soon.
I'm just glad to hear that you're incorporating fun into, traditional, information for your community. So, I mean, that sounds amazing. And it definitely addresses a need.
Yeah. And it also highlights, again, the sense of community. It's interesting because what you've done is to sort of turn the isolation on its head, isn't it? By bringing people together into the partnerships and then also to help people understand how do you get back to the traditions and bringing those back in. It's really interesting. And I want to now learn how to count in some of these languages now too. So I'm going to have to go to the PDFs.
Foraging video or foraging fact sheet that we did.
Yeah.
Yes. So you can go foraging yourself. It has pictures. So you can go pick for yourself. We try to include everything. We've got to keep the kids entertained. We also have book lists for youth, children, adults, a little bit of academic stuff as well if you're feeling like getting your academia on. Yeah. But we try to be well-rounded, and we're still, people are still looking to see what we're doing, and everything is available on our website.
And it's amazing because, as you said, like you gave a little bit and they said, oh, we want more. And there's always more you can do. But I think you've really identified that there's a need out there and you're working to fill that need. And I'm wondering, Ethel, given your position as an Indigenous elder, is there anything else that you would want the innovators, like Carrie and Sadie, to know about how they can support you and your community so you can maintain your health during this challenging time?
I think like a lot of our family units have kind of like an awakened sense of creativity. If they can manage to, the innovators to encourage and support families into a type of a renewal of what the family systems are about, how to strengthen that, how to continue on this kind of like this renewal and the connection, the communications between parents and their children. All of that I've seen is happening, and it's very good. It's very good to be able to hear people, through social media saying, "Oh, I made these regalia with me and my children. I did something creative. We went out and peeled teepee poles, and there was just tiny little ones that were there stripping, the teepee poles, helping their aunts and their mother. And that was so heartwarming for me to know that families have been thrown together to do things together once again, and that was not there before.
We often ask our guests, because our guests often have such great journeys of resiliency. And I think hopefully I can speak for Allison to say that we feel this, that way about the three of you. We'd love to have your singular advice for our audience about how to age successfully from your perspective. So I don't know, Ethel, did you want to kick us off? What would be your advice for our listeners?
Well, for years now, I've been trying to support people in finding a balance in a holistic way. And I did an exercise yesterday morning using the holistic system and doing artwork in that. And I found that I am at this point in my life where everything is so much in balance because of my own awareness as to who I am and where I want to go. I believe that, when you find your balance and accept the things you cannot change and learn from your own personal experience, I think that we can age gracefully by using, our common sense and just allowing ourselves to live life in the beauty of what is there and finding it.
Thank you.
To me, that's so peaceful.
Words to live by, Ethel. I'm definitely going to try to incorporate that more into my life. I will definitely say that. Sadie, your singular advice for successful aging.
Well, I don't know that I've successfully aged.
To this point,
I would say drink lots of water and find a job that you love. Because if you love your job, you're not going to be stressed out, even if it's chaotic and you're doing a million things. You will just love it, and it will help you thrive. So drink lots of water and get a job you love.
Hydration and passion for the job. Understood. Carrie, your singular advice for successful aging.
Yeah, I'm not sure if I have either, to be honest with you. Some days are difficult, but I think that's the beauty of it, right? I think that for me, it's very similar to Sadie. If you love what you do, it's not work, and I feel like I learn more from the people that I work with, and the communities that teach me, and the elders that I'm able to be honored to learn with and learn from and walk together. It's, honestly, it's sort of a mix, and I know it's not a one singular, but I really feel that the job that I do is actually not a job. It's really part of my life and part of what Creator put me here for. And so I'll just keep going around those curves and twists and paths and be grateful that I'm blessed to be able to do this kind of work, but really it's teaching me a lot more than anything else. So thank you so much for having me today.
Thanks. Yeah. An elder from Six Nations near where I live once told me that the wind takes us where we need to be. And it sounds like from the responses that's, you feel as though the wind's taken you to be leading the Morning Star Lodge and to be working there and to be helping advance Indigenous health across Canada and beyond. So thank you for that. What we like to do also to end the podcast is to ask if you guys have any resources that you'd like to share with a broader community. They can be selfish or they can be selfless. So it could be, for example, where do people go to find the Protecting Our Home Fires information or something that you turn to yourself that helps you just continue to have that passion and that love for the community.
If you want any of our stuff, it's available at www.indigenoushealthlab.com. And we have a tab called the Home Fires, Protecting Our Home Fires. It's a tab, and you can click it. It will take you to a listing of everything where it's all downloadable as a PDF. You can also find us on YouTube under our channel, which is Morning Star Lodge, where we have all of our videos. That's also linked on our blog, on our website. We're all interconnected. We have a Facebook, we have an Instagram, we have a
You're
Twitter.
Everywhere.
Yep, and it's all Morning Star Lodge or Morning Star Lab for Twitter because there's too many letters. So please do come find us and interact with us. We post regularly, pretty much everything we do. We're pretty active now, so that's where you can find anything to do with Morningstar Lodge and the Protecting Our Home Fire strategy or things that we've put out.
Ethel, Carrie, are there any resources you guys would like to share?
My most important resource is my own family and community, and learning how to reach out to them and asking them a simple question, and they are more than willing to turn you to the direction that you need to go to. And to me, that's been very helpful.
Terrific.
Yeah, and I think, we couldn't do the work that we do without the elders and knowledge keepers. So I echo Elder Ethel, and thank you so much for agreeing to be on this podcast, because, really, we talk about PhDs. Elders are our PhDs.
Yeah.
They're our resource, and we could not do any of this without them. And that's our resource. And I think of my grandfather, my late grandfather. For me personally, he was my resource, and I know he put me on this path. And I feel like everybody that I've interacted with is because of him, and that it's that ancestral connection, really. So maybe it's not very helpful, but just something personal for me.
I think it's a great way. It's a great way to sort of sum it up that one of our greatest resources is each other. And that's the next thing I just want to do is to thank all of you guys for taking the time to join us on this episode on Indigenous health during the COVID-19 pandemic. Thanks for joining us in this conversation and in sharing all of your insights, and I think in inspiring us all to see the silver lining of things, to get back to our roots wherever we can, and to connect with others however we can under the current circumstances, to maintain those relationships. I think that it's some great lessons I think that we've learned. So thank you, Miigwech, to Dr. Carrie Bourassa, to Sadie Anderson, and Elder Ethel Starblanket-Dubois. Elder Ethel summed it up by saying, live life in the beauty of what is there and in finding it. So thank you guys so much for that. I also want to thank our podcast production team, including Simon Cheeseman, Ariel Townsend, and Soren Chular.
So I just want to also add my thanks to our guests today, because I think it inspires me to think a little more internally and look to my community, my family, my friends, to really take a deeper look at that. So thank you guys so much. I also want to say, to learn more about CABI, please visit us at www.cabhi.com. And for more information about Baycrest at Home, please visit www.baycrestathome.ca. As we continue to navigate these unprecedented times, we hope that all of our listeners stay safe and well. And we look forward to our next episode in our COVID podcast mini-series. So thank you.
Thank you.
Miigwech.
Thank you.
Miigwech.